I did not know I had uterine fibroids. I just knew I was bleeding a lot. My cycles were lasting about 3 weeks every month. And over the course of a couple of years, it got to the point where I was bleeding so much that I was losing too much blood. When I was diagnosed with the uterine fibroids and learning for the first time why I was bleeding so much, my doctor laid out a few options to me. It was only in casual conversation with a friend and client when I found out about focused ultrasound, at which point I went to the computer and on my own looked it up, looked at the side effects, looked at the process, looked at this development as a treatment. After doing the reading, it seemed as though focused ultrasound as a treatment option offered way fewer side effects than any of the other treatments. Going in its favor, the focused ultrasound was not going to alter my hormone levels. It did not involve losing my uterus. It did not involve being cut open. It did not involve a lot of downtime from a surgery. You're not put under completely. And in evaluating all of the side effects of the various treatments, focused ultrasound seemed to me like the best option. The first period that I had after the procedure was shorter than the ones that I'd had before the procedure. Over the course of a few months, they ended up getting progressively lighter and lighter until about, I would say, 4 to 6 months after the procedure, I was back to having a period that was only about 5 to 7 days, as opposed to the 3 weeks that I'd been experiencing. I had my body back and my freedom back. That was very much worth going through the process. I think women deserve access to focused ultrasound because there aren't enough options given to us by the insurance companies or by our doctors or by the nurse practitioners. The options that I was given were the ones that have been around for the most years, and they're the ones that maybe have worked for a lot of people, but they don't take into account new technologies, and focused ultrasound is a newer technology. I would feel very comfortable recommending focused ultrasound to anyone that asked me. Given the specifics of my age and my lifestyle and how much I was willing to participate in the treatment, focused ultrasound was the perfect option for me.